Hey Tom, guess what? It's raining. It's pouring.
Yes, and we're not.
Yeah, but we're not getting wet. We're here to hear about some more on them bones.
Yes, hey everybody, can you hear the rain in the background? It is pouring down here in Raleigh, North Carolina. We've had a major thunderstorm. It's lasted for about an hour, but we're right here and we're going to talk about osteoporosis and all the minerals that go along with osteoporosis and how do we deal with this dreadful disease. And well, how about that? They said the weather can stop us, but maybe not. But my name is Tom Jones. I'm the pharmacist, and guess what? We're here live in Raleigh, North Carolina, and it's all about osteoporosis and what do you do about minerals and how does that affect your life. And we started our program last night and talked about osteoporosis and the things that we can deal with it. And of course, it's when you lose bone and when you have problems. So mostly it's postmenopausal and menopausal and premenopausal ladies, and it's the guys also. It just happens to be a little bit less, it starts a little bit later for the guys, but still the bottom line is it's about fractures and how you prevent fractures and how do you keep from having brittle bones. And we know that last night's study stipulated that osteoporosis is actually the 12th most cause of death in the United States. And that's pretty doggone significant if you stop and think about it. It affects many more lives than you would ever imagine. And it actually, the diseases that contribute to osteoporosis are rheumatoid arthritis and asthma and diabetes and liver and thyroid disease, depression, chronic diarrhea, COPD, metabolic acidosis, and GI disorders. These all are the diseases that actually take away from our bone matrix the minerals that we need in order to make the bone be more better and not be brittle. All right, and we talked about last night the different medications that affect people with osteoporosis. All right, number one, the corticosteroids, the prednisones, the prednisones, the Medrol dose patch. What they do, they inhibit the calcium, and thank you, Regina Whitaker, for joining in. Occasionally I will get the names of the people that's actually on the broadcast. I will announce it. Not everybody is, I think it's mostly my friends that actually have tuned in, but we're going worldwide, you know. That's a big, it's a big doggone world out there. So just, what did you say, Ann?
Send you a
Send me a, if you want to get announced on the air, send me a friend request. I'll be more than happy to announce you if I know you're there. So, and Regina says hello. Anyway, corticosteroids actually will inhibit calcium's absorption in the GI tract. So therefore you actually excrete more calcium from the body. And this, it alters the regulation of the hormones involved in bone remodeling. And this actually prevents the bone from building back. And that's really, really, really important. And it inhibits the formation of osteoblasts. Well, let me tell you what osteoblasts are. That's when your bone rebuilds. Osteoclast is when it's breaking down. When it rebuilds, you've got a rebuilding process that will actually bring your bones back where they are stronger. And we want to have strong bones. Think about this. How many people have you known that have had a hip fracture? And we learned last night that the people who have a hip fracture, they a lot of times do not make it through the process. So as we get older and the body gives away and the bones get weak and brittle, more death occurs. Take it away. 12 in the list of diseases that kills people. You never think about that until you come across an individual who has had a hip fracture. And 1 out of 4 of these individuals are going to actually not make it. They're going to succumb to the situation. All right. So we talked about the corticosteroids. How about the thyroid? Thyroid actually increases osteoclastic activity. And what that simply means is the bone is broken down and placed into the blood. It doesn't allow osteoblast from occurring. So therefore the bone cannot rebuild. It tears it down. Heparin does the same thing. It increases the activity of the osteoclastic activity and decreases the osteoblastic rebuilding of the bone. So methotrexate, another key drug that basically a lot of people have had to use over the years, that increases calcium excretion and it interferes with vitamin D activity. And of course vitamin D is necessary to rebuild the bone. So now we've got the anticonvulsants. And this plays a role also because that decreases the calcium reabsorption and it increases the calcium excretion from the body. So if you have a decrease in absorption and it interferes with the vitamin D activity also. Antacids decrease calcium and phosphorus. Now here's the first time we've mentioned phosphorus. That's the absorption. You have to have phosphorus in the body, in the bone, for it to work properly. And that allows the urinary tract to bring calcium out of the body by excretion. Diuretics, because we have to take diuretics to get fluid out of the body. Well, unfortunately, it also increases the amount of calcium excretion also. And antibiotics, all right? Of course, we know antibiotics alters the GI flora, and when it alters that flora, we don't get the vitamin B production in the body as well, and vitamin K production. So tetracycline, one of the old-time antibiotics, actually inhibits calcium absorption. So this is kind of a problematic, it's not kind of, it's a real problem for your bones when it's not able to rebuild and remold and remodel your bone structure. There again, if you have weak, brittle bones and you fall, you have the potential to break a bone or fracture a bone. And it really needs to repair for you to get back up and actually get into the world of life again. How many people do you see or hear that have osteoporosis? How many people do you see or hear who have broken bones? And medications can actually, tranquilizers, sedatives, sleeping medications, blood pressure medications, and other medications can cause us to have major problems as far as fractures, and that's probably worth about 35,000 fractures a year just by people having drug problems, having reactions to medications that makes them drowsy. They are trying to go somewhere and they fall and get a fracture or a broken bone. Alrighty, wow. So, you know, the aging process is not so doggone great, because as we age, all of our body processes do not work nearly as well as they did when we were younger. So the name of the game is to stay healthier. The guys actually have a better situation here, because think about it. As you're growing up, male and female are pretty well equal until you hit the early 20s. Then in the early 20s, males actually build more muscle bone mass. And the bone mass is really, really important, because the better bone mass that you have, the better bone structure you're going to have. And society. Society wants young ladies, women, to actually be thinner. Okay. Weight is an issue here. But also, bone structure is an even worse issue, because the lower body mass you have, the more potential. I'm not saying in all cases, but the potential is there for less rigid bones, less firm bones, bones that will not stand the test of time. The one key thing that you can do actually is very, very important here. The one key thing that you can do is exercise. Weight-bearing exercise. And what do I mean by weight-bearing? Weight-bearing is when you're standing on your feet. Weight-bearing is a great preventative situation for you to actually rebuild and have the osteoblast working in your favor. And Regina is asked a question. She's heard that Crestor depletes the muscles. Is that true? There is a muscular disorder that can be with all of the cholesterol-lowering drugs. Specifically, probably not. But I'm going to look up in the literature and go over all the different aspects for you, Regina. I will get back with you in a private email message or private Facebook message, and I'll let you know definitively if that is actually in the literature or not. Because you want to have strong, great bones as you progress in your later lives. And thank you, Regina. We always request that you ask us questions. We'll give you the answers. We may look this up. We want to be sure that we're right when we give you that answer, and it is important from your standpoint. Last night we discussed this, but we're going to go back over it again. All right. What are some warning signs of osteoporosis and osteopenia? Osteopenia is the prelude for osteoporosis. That's the first step. That's when you actually have a loss of bone mass in your body. So, all right, bone pain. All right, if you have pain, yes, broken bones. That's a big, big indicator that you may have some issues. Loss of height, bone formation, deformities, brittle, soft fingernails, leg cramps. Leg cramps are a potential sign. Restless leg syndrome. That could be an osteoporotic or osteopenia or prelude for the osteoporosis. Low back pain and cervical curvature of the spine, the lower spine. Periodontal disease is a really big indicator that something's going on in your body. You can, and when you go to the dentist, if he or she, the dentist, makes a recommendation to you to check about osteopenia or osteoporosis, be sure to follow through on that. Receding gums, another indicating factor, a warning sign. Thin, transparent skin, teeth discoloration, a crack in the tooth. And some people find out that they actually have osteopenia, osteoporosis by having a hole in their tooth. very, very, very important. This decreasing muscle mass. And when you develop a situation in which the muscles tend to not build as well, that's an indicating factor that you are not building your body and having the bone resorption that you really need. Premature aging of the hair. So if you are graying, if you're 50% gray by age 40, you may have an indicating factor of osteopenia, osteoporosis, loss of hair, another indicating factor, and irregular heartbeat. Can you imagine what you can have looking forward to if you develop osteopenia or osteoporosis early in life? And a lot of people do, because it's all about how you prepare your life for this tragedy, really. All right. From a nutritional standpoint, the pH of your body is very important. An acid pH is not so good, not as far as bone resorption and building back the bone in the body. An acid pH is a negative. You want more of a 7.0 to 7.5, which would be a little basic. And it really, at nighttime is when you want your body to actually be, you want your body to be more basic, and minerals from the bone tissue will actually go into the blood because the body thinks that it needs to have more minerals placed into the body. So an acid pH also increases susceptibility to illnesses and to infections. Some of your most alkaline foods are lentils and limes and onions. More alkaline are broccoli and cantaloupe, garlic. Low alkaline are almonds and apples and avocado, and lowest alkaline are apricots and bananas, beets, things of there. But now, here's the lowest acid. And the lowest acid, brown rice, canola oil, creams, eggs, fish. Low acid are alcohol, chard, cheese, aged cow's milk. More acid is carrots, chickpeas, chicken, coffee. And most acid are barley, beets, beef, beer, Brazil nuts, cocoa, and hazelnuts. So, goodness gracious. What I'm going to do, this is an important chart. I'm going to make this chart up for everybody and actually put it on our website. You'll be able to, and I'll put this on our Facebook page also, because you need to know what foods are best to actually help prevent osteoporosis. All right. Now we're going to talk about something that is super duper important. And the rain is still coming down here in Raleigh, North Carolina, but we're going to go into an area that most people probably have never studied. And this is really, really important because trace minerals help the body and build bone. You have to have all of these minerals in the body, because if you don't have them, the bone matrix doesn't work nearly as well, and you can absolutely have more problems than you ever dreamed about. One of the first minerals that I'm going to mention is magnesium. Now, magnesium is one of the most plentiful ingredients in your body. It's a mineral that actually is in your body, and it's very, very, very important. Magnesium, it actually competes against with calcium, although it's also assisting in calcium uptake. So studies show that magnesium plays a tremendous role in body and bone mass and aids in reversing bone loss. Let's go back over that again. Magnesium plays a major role in bone mass and in reversing bone loss. You have to have magnesium in the body in order to rebuild and have the osteoblast working efficiently to build that bone matrix. It's got a lot of activities in the body, and most people do not have enough magnesium. They're pretty well deficient for the most part as far as magnesium in the body. For men, it's best to have a 1-to-2 ratio of magnesium to calcium ratio. 1 part magnesium, 2 parts calcium. In women, it's really thought to be equal. You need an equal amount of magnesium to an equal amount of calcium. And actually that is very important in coming up with the proper recommendation and dosage for building back that bone. So magnesium is super, super important, and it's pretty well deficient for most people. Boron. Boron is another trace mineral, and that actually optimizes calcium uptake and metabolism. So you only need just a small amount of boron, 1 to 3 milligrams of boron, but a lot of people do not have that trace mineral in their body. A study of postmenopausal women actually revealed that if you supplemented with 3 milligrams of boron daily, you do see a significant reduction in the excretion of calcium, magnesium, and phosphorus. Those are 3 different ingredients that are needed in the bone matrix. Another key element that the body needs is copper. You need just a small amount, and it's a trace element. It's a mineral, and it's essential in collagen formation. So copper in small amounts, actually, that's typically 1.5 milligrams to 3 milligrams. That's a very small amount, but you need it in the bone matrix to actually get collagen formation in the bone. Manganese, another trace mineral, and that's essential in proper bone turnover. And what this does, it will decrease the bone calcification and increase bone resorption. We need it just plays a good role in the body as far as enzymes being responsible for forming that matrix, allowing mineralization of the bone to occur. So you just need a little bit, a small amount of 2 to 15 milligrams of actual manganese. Phosphorus, we mentioned that a while ago. Phosphorus is another, it's the second most abundant mineral in the body. And 1/4 of all mineral material is phosphorus. So it's essential for cell growth and repair and energy production and heart contraction, nerve and muscle activity, and calcium and glucose and fat and starch metabolism and pH buffering. Do you sense now that there's a lot of activity in that bone matrix occurring in the body at all times? Because you want to have strength and you want to have the framework in our bones and in our teeth. Because without the ability to have good teeth and without the ability to be able to have the frame, which the bones are, in fact, you can have not such a good life. So when calcium is removed from the body and all the trace minerals are depleted, the bone just doesn't refurbish itself. It doesn't go back into the state that we need it to be. So again, all right, we talked 2 weeks ago about balancing your hormones to get your body back right during our older years. Last week we talked about balancing our hormones for the guys. So the first week was for the ladies, last week was for the guys. Now we're talking about balancing the mineral production in the body so that our bones will grow back the way they should. The osteoblasts work for reforming and rebuilding the bone matrix. When it's not there, when the minerals are not there, when it's disproportionated, when it's unbalanced, you have problems that occur. Silica is another mineral that's pretty well abundant, and actually it increases bone mineralization and strength even in the absence of adequate calcium levels. So silica is another trace mineral. We probably would never even think about some of these trace minerals if we didn't think about osteoporosis and osteopenia's prevention. Vanadium is important to bone tissue formation. Forming that trace mineral in the teeth and in the bones itself is so vitally important. And if you smoke, you probably don't have enough vanadium. Vanadium is depleted when people smoke. And how many people still smoke? Oh my goodness, that is awful. Zinc, the role of zinc in osteoporosis is multifold. It produces the matrix for the collagen protein threads that actually deposit in the bone, forming the calcium phosphorus compound. Zinc's required for great calcium absorption. It's also linked with this proportion of vitamin D if you don't have enough zinc in your bone, in your body. So that's another key factor. Next, we talk about vitamin K. Vitamin K has a major role in bone health and formation, and is probably just as important as calcium in bone formation. So it's required for the synthesis of one of the key elements, osteocalcin, in the body, and it actually is super important. So vitamin K, vitamin D. We've already talked about the importance of vitamin D in the body. Vitamin D is one of the most essential elements to build the immune system. Vitamin D is for so many different properties, but here, vitamin D is essential for calcium and phosphorus transport into the blood system. So 80% of all hip fractures are related to vitamin D deficiency. Oh my goodness. Next, we'll talk about vitamin C. Vitamin C is actually that antioxidant, and it's really very important in the formation of collagen in the body, in that bone matrix. The B complex vitamins, we're talking about their essentialness for good health and proper metabolism, but here all of the vitamin Bs together help the bone build itself back up. Biotin, you think of that for your hair, but biotin has more than just the hair. It's for the cell growth, it's for the fatty acid formation, and it helps utilize all of those B vitamins that we just talked about. Without vitamin A, you will have not as much osteoblastic activity and bone matrix formation. Oh my goodness, it's all across the board. It's all due to having the right balance, having the right amounts. They may be small, but they are super effective, super important in building the bone and having the bone repair itself. Osteoblasts form the matrix of the bone and rebuilds the bone. Osteoclasts break down the bone and actually allow the osteoblast to rebuild and remodel the bone. Can be resorption, and that's not good. But when the body breaks down that matrix and you have that tear down of the bone, you have to rebuild it. And when someone has a fracture, when someone has a break, if it doesn't repair, you have to actually get back. You have to actually get back and allow the body to rebuild that bone. If it doesn't occur, the fracture or break can occur again. Remember, osteoporosis is the 12th leading cause of death in the United States. It affects many, many, many households. It affects people who are aging, and you do not want to have a broken bone. One of the key factors here, again, is standing up and doing weight-bearing exercise. Weight-bearing exercise is a wonderful asset for anyone who is getting elderly and who needs to restable their body and rebuild their bones. It's probably the number one effect of all things that we can do. However, closely behind is actually rebuilding and balancing your minerals that you take in the body. So later on this week, we're going to talk about calcium and what you should be thinking about as what strengths, what dosage, all of the different parameters. But it was important tonight to discuss the other part of the equation, the minerals that go along with the calcium to help rebuild that bone matrix. I hope you've enjoyed what we talked about tonight. It's raining still here in Raleigh, North Carolina, but building your bones and actually keeping your body healthy as you grow older is super important. And again, I want to reiterate, you start this process when you're young, in your teens, in the 20s, the early 20s, you've got the highest bone density of all your lifetime. It goes down from there. So you need to restart your program and start a program early in your life. The better and sooner that you start, the better you will be in the long run. All right, part 3 tomorrow night, and that will be osteoporosis. We'll talk tomorrow afternoon on our Today with Tom show. We may even go back over the diabetes today, but that we had today. But you have been here live with Tom Jones, Pharmacist, live from Raleigh, North Carolina, and we've talked about osteoporosis. We'll continue the saga tomorrow night when we talk about osteoporosis again. We love you, and send us any question that you've got. Let us have the question.
And tell your friends about
And
us.
tell your friends about it. If you want to be mentioned on the air, be sure to actually like us, and that way you'll be able to ask the question on the air. We'll respond to your questions and give you the answers. And we love you so much. We thank you so much. And tell your friends, we want to help educate. We want to coach. We want to actually consult you and help you in any way that we can. Good night, and we'll see you tomorrow.